Maybe you've already tried melatonin or ashwagandha or one of those fancy deep sleep teas that promises rest but leave you wide-eyed at 3 a.m. Then your doctor says, let's try Trazodone. And you're like, wait, isn't that an antidepressant? I think I've heard of it. You're not even depressed. So what gives? Let's clear that up. I'm Dr. David Danish, a double board certified psychiatrist who's prescribed Trazodone to thousands of patients and usually to good outcome. Usually not for depression though, but for insomnia. It's one of those medications that the real world uses very differently than how it was originally intended. So let's walk through it. The good, the bad, and what I've actually seen in practice. What's it supposed to do? Trazodone is technically an antidepressant, and that's how it was invented. But in modern psychiatry, it's rarely used for that. Instead, it's one of my go-to tools for insomnia, especially when the problem isn't falling asleep, but staying asleep. If you're someone who's up at 3 a.m. night after night, this is where Trazodone can shine. It's classified as something called an SARI, a serotonin antagonist and reuptake inhibitor. In plain English, it lightly boosts serotonin while also blocking certain brain receptors that keep you alert. So, 5-HT2A and histamine receptors being blocked, that leads to improved sleep. The combination makes it sedating, but not in a knock you out kind of way, more like a strong nudge into a deeper, more restful sleep. At lower doses, think 25, 50, 75, 100 milligrams, it doesn't act like an antidepressant at all. Instead, it helps increase slow wave sleep, which is the deep, restorative kind your brain needs to reset and heal. And it's been studied in older adults, including those with dementia, without memory issues or delirium risks we see with many other sleep medications. That said, any sedating medication still comes with a fall risk, so we dose carefully, especially in folks over the age of 65. So how long does it take to work? For sleep, Trazodone usually kicks in within 30 to 60 minutes. If it's a good fit, people often notice fewer awakenings, deeper sleep, and feeling more refreshed the next day. When it is used for depression or anxiety, which is less common again, it may take 2 to 4 weeks to show any benefits. But again, that's not why most doctors reach for it today. Let's discuss side effects and potential red flags. Remember, no medication is perfect, and Trazodone has a few unique side effects worth knowing. Common and short-term side effects that I'm not too worried about are drowsiness, which is our goal, dry mouth, dizziness, some morning grogginess, especially if the dose is a little bit too high. Some will get a little nausea or mild headaches. These usually show up in the first few days and tend to fade as your body adjusts to Trazodone. Side effects that sometimes stick around. That morning fog or feeling a little bit off the next morning or even the whole next day, that's no bueno. Constipation. Sexual side effects are much less common with Trazodone than SSRIs and SNRIs, but are still possible. Red flag side effects that mean you should stop and call your provider include feeling more anxious, more irritable after starting it, and that means on an ongoing basis, too much emotional numbing, mood swings, or sudden drop in blood pressure when standing, which we call orthostatic hypotension. And that's where when you get up quickly and you're kind of feeling dizzy or, God forbid, even blackout. Those rare side effects, the 1 in 100, 1 in 1,000 side effects, something that is known to be associated with Trazodone is called priapism, or a sustained erection that is not able to go down unless you go to the emergency room. And that is potentially something that could have permanent damage on male genitalia. Heart rhythm changes, especially in people with heart disease or those on other medications that can prolong the QT interval. So that's something to talk to your practitioner about. Trazodone works on serotonin, so if you're combining this with a lot of other medications or supplements that work on serotonin, watch out for that potential risk. Like all antidepressants, Trazodone carries a FDA warning about increased suicidal thoughts in patients under the age of 25. In large studies, this shows up in less than 1 in 132 people starting an antidepressant. It's rare, but we have to keep an eye out for it. Okay, what's my take? Clinically, I find Trazodone to be one of the most reliable, non-habit forming sleep medications out there. I use it when someone is overstimulated at night, waking up repeatedly, or feeling wired and tired at the same time. I typically start low, 25 milligrams maybe the first night, with a quick increase to 50 milligrams if the 25 was not enough. I rarely go above 200 milligrams nightly. If someone tells me, I fall asleep fine, but at 2 a.m. every night I just start staring at the ceiling, Trazodone is often my first thought. It's not a sledgehammer like some prescription sleeping pills. It's more like a soft weight pulling your brain into slow wave sleep. That deep sleep supports mood, memory, emotion regulation, even likely prevents dementia. When it works, patients often say, I don't feel drugged, I just feel rested. That said, it's not for everyone. Around 10% of my patients feel too groggy or just off the next day. And if that's you, no shame, there are plenty of other options out there that are safe and not addictive. But for the right person, Trazodone is one of the most underappreciated medications in modern psychiatry. Gentle, safe, and surprisingly effective for sleep. If this helped, subscribe and head over to drdaviddanish.com. Inside the Mind Vault, I put together 2 free resources that go deeper. Lastly, if sleep is a major issue for you right now, check out sleepscriptmd.com. They offer same-day prescriptions for non-addictive sleep medications, including Trazodone. They also can offer at-home sleep testing for issues like sleep apnea in case you're worried you may have that. They have flexible treatment plans that fit your schedule, so it's easy to start. Starting a new medication can feel intimidating, but it's also a beginning. And for many people, the right sleep support changes everything. Take good care, and I'll see you in the next video.